everyone. Happy Sunday. So today my topic is going to be on hepatitis. It's going to be probably at least 3-part series because hepatitis is a big topic. And sometimes many people confuse the different types of hepatitis. I want to make sure that we are clear on the various hepatitis. So for today, I'm going to be covering on hepatitis A specifically. So May is Hepatitis Awareness Month. So what is hepatitis? Hepatitis is a general term used to describe inflammation of the liver. Liver inflammation can be caused by several viruses called viral hepatitis, chemicals, drugs, alcohol, certain genetic disorders, or by an overactive immune system that mistakenly attacks the liver called autoimmune hepatitis. Depending on its course, hepatitis can be acute, which flares up suddenly and then goes away, or chronic, which is a long-term condition, usually producing more subtle symptoms and progressive liver damage. The liver, if you don't know, is a large organ that sits up under your ribs on the right side of your belly, your abdomen. It helps to filter waste from your body, makes bile to help digest food, and stores sugar that your body uses for energy. So the various types of hepatitis, which I'll be touching on a weekly basis, there are 5 viruses that I'd like to focus on. The different viruses are called by a letter: hepatitis A, B, C, D, and E. Today, I will be reviewing hepatitis A. So what is hepatitis A? Hepatitis A is a highly contagious liver infection caused by the hepatitis A virus. People are most likely to get hepatitis A from a contaminated food or water, or from close contact with a person or object that is infected. Mild cases of hepatitis A don't require treatment. Most people who are infected recover completely with no permanent liver damage. Practicing good hygiene, including washing your hands frequently, can prevent the spread of the virus. Hepatitis A vaccine can protect against hepatitis A. Hepatitis A is the easiest to transmit, especially in children, but is also the least likely to damage the liver and is usually mild and is completely resolved within 6 months. So what are the signs and symptoms? Unusual tiredness and weakness, sudden nausea and vomiting and diarrhea, abdominal pain or discomfort, especially in the upper right side beneath your lower ribs, which is over your liver, clay or gray colored stool, loss of appetite, low-grade fevers, dark urine, joint pains, yellowing of the skin and the whites of your eyes, which is called jaundice, and intense itching consistently. These symptoms may be relatively mild or go away in a few weeks. Sometimes, however, hepatitis A results in severe illness that lasts, again, for several months. So what are the risk factors? A person is at risk for hepatitis A if you travel or work in areas of the world where hepatitis A is uncommon, live with another person who has hepatitis A, or a man who has sexual contact with other men, have any type of sexual contact with someone who has hepatitis A, if you're HIV positive, a lot of homeless people, use any type of recreational drugs, not just those that are injected. Specific ways the hepatitis A virus can be spread: eating food handled by someone with the virus who doesn't thoroughly wash hands after using the toilet, the bathroom, drinking contaminated water, eating food washed in contaminated water. Now, this is something that a lot of people speak of, and I have seen that: eating raw shellfish from water polluted with sewage. So if you're eating shellfish that's harvested from contaminated water, developing countries experience hepatitis A epidemics caused by the drinking water contaminated from the raw sewage. That's usually how it's get there. Being in close contact again with someone who has the virus, even if the person has no symptoms, and having sexual contact with someone who has the virus. How is it diagnosed? Through a physical exam, blood test, a doctor may do ultrasound, and if necessary, a biopsy may be done. What are the treatments? Anti-intoxication therapy. They do diet, vitamin therapy, corticosteroids, enzymes, just to name a few. So what are the complications if someone has hepatitis A? Unlike other types of viral hepatitis, hepatitis A does not cause long-term liver damage, and it doesn't become an ongoing chronic infection. In rare cases, however, hepatitis A can cause a sudden acute loss of liver function, especially in older adults or people with chronic liver diseases. Acute liver failure requires a stay in the hospital for monitoring and treatment. Some people with acute liver failure may need a liver transplant. Prevention. The Centers for Disease Control and Prevention recommends that hepatitis A vaccine for the following people: all children of age 1 year or older children who didn't receive the childhood vaccine, anyone age 1 year or older who is homeless, infants ages 6 to 11 months traveling to parts of the world where hepatitis A is common, family and caregivers of adoptees from countries where hepatitis A is common, people in direct contact with others who have hepatitis A, laboratory workers who may come into contact with hepatitis A, men who have intercourse with other men, people who work or travel in parts of the world where hepatitis A is common, people who use any type of recreational drugs, not just injected ones, people with chronic liver disease, including hepatitis B and hepatitis C, and anyone wishing to obtain protection immunity. If you're concerned about your risk for hepatitis A, ask your healthcare provider if you should be vaccinated. What you do whenever you are traveling, if you're traveling to parts of the world where hepatitis A outbreaks occur, take these steps to prevent the infection. Wash all fruits and vegetables in bottled water and peel them yourself. Avoid pre-cut fruit and vegetables. Don't eat raw or undercooked meat and fish. Drink bottled water and use it when brushing your teeth. Avoid all beverages of unknown purity. The same goes for ice. If bottled water isn't available, boil tap water before drinking it or using it to make ice. Thoroughly wash your hands often is key, especially after using the bathroom or changing a diaper and before preparing food or eating. When should someone see a doctor? Make an appointment with your healthcare provider if you have symptoms of hepatitis A. Getting the hepatitis A vaccine or an injection of an antibody called immunoglobulin within 2 weeks of exposure of the hepatitis A virus may protect you from infection. Ask your healthcare provider or your local health department about receiving the hepatitis A vaccine if you traveled recently to areas where the virus is common, particularly places like Mexico, Central America, and South America, or to those areas with poor sanitation. You ate at a restaurant with a hepatitis A outbreak. You live with someone who has hepatitis A. You recently had sexual contact with someone who has hepatitis A. Key points about hepatitis A. The prognosis for hepatitis A patients is excellent, with self-limiting, of course, and recovery is complete. About 85% of people with hepatitis A recover within 3 months, and almost all recover within 6 months. The disease does not become chronic, and there are no long-term health implications. A highly contagious liver infection caused by the hepatitis A virus, that's what it is. Hepatitis A is preventable by vaccine. It spreads from contaminated food or water or contact with someone who's infected. Symptoms, again, may include fatigue, nausea, abdominal pain, loss of appetite, and low-grade fever. Excuse me. The condition clears up on its own. As I stated before, rest and adequate hydration can help. Next Sunday, we will cover hepatitis B. Thank you so much for your time. I hope this was helpful. Enjoy the rest of the service and God bless.